Good day. My name is Zecris Enriquez. So for today, I will be performing a bed bath for adult client. So what does bed bath mean? So bed bath is to remove transient microorganisms, body secretions and excretions, and also the dead skin cells. It also to prevent and eliminate unpleasant odors, and of course to relax and comfort the patient. So next, I will be identify the patient.
I'm Enriquez and my birthday is September 2000.
Okay, thank you, ma'am. Now I will perform a hand hygiene. Put a sterile gloves to maintain sterility. Now, here's are the material that I will be needing. First,
would you like to use a bedpan or urinal before we proceed? In a clinical environment, I need to elevate a working surface to a comfortable level and lower the side rails next to me to support proper body mechanics and guarantee the safety of our patient. So now, I'm going to place a bath blanket over the patient. Now, I'm going to remove a soil top sheet. This is to ensure warmth, privacy, and comfort to the patient. And I'm going to place this on the hamper. Now, I'm going to remove the patient's gown. So, if the patient has an intravenous line, injury, or disease mobility, begin at the unaffected side. Remove the patient's gown. I have here a basin with warm water that's about 2/3 full, and it is 43 to 46 degrees Celsius.
Ma'am, can you check the water for me if it's hot or cold?
Of the face, the first thing that I'm going to do is to place the bath towels appropriately.
I will remove the pillow.
Second bath towel should be placed over the patient's chest. I am going to wash the patient's eyes. In washing the patient's eyes, first thing I am going to do is to soak the washcloth into the water and rinse it thoroughly. And then, I am going to fold it to create a bath mitt. So this is to retain the heat and water and prevent dragging the washcloth into the skin. going to start from inner canthus towards the outer canthus using the separate section of the washcloth for each eye. So, this is to prevent the transmission of microorganisms from one eye to another. Now we're going to proceed in washing her forehead, cheeks, ears, nose, and neck. So now I'm going to start in her forehead, and then cheeks, then nose, ears, and then neck. For washing the patient's arm and hands, the first things we're going to do is to expose the forearm of the patient and place the bath towel and dress underneath the patient's arm. So now, I'm going to place a bath towel underneath her arm. Start washing his axillary, then I'm going to put some on the other one. Now I'm going to start washing the patient's arm first in a distal to proximal manner using a long, firm strokes. So now I'm going to proceed with her hands and fingernails. Now, I'm going to proceed in washing the patient's chest and abdomen by placing the bath towel across the patient's chest while lowering the bath blanket towards her umbilical area. Now I'm going to proceed with washing the patient's chest and abdomen. I'm going to lower down the bath blanket towards her pubic area. Then I'm going to start washing this abdomen using a long, firm strokes. I'm going to expose the patient's leg and folding the blanket. To start washing the patient's leg using a firm long stroke, starting from the ankle towards the knee and then feet towards the leg. To put some moisturizing lotion to moisturize the foot on my patient. am done with my patient's anterior side of the body, I'm now going to discard the washcloth and maintain the patient's privacy. Refill the basin with clean water and change a clean pair of gloves and apply perineal care as necessary. A newly refilled basin washcloth and neat pairs gloves. Now I am going to perform perineal care to the patient. Done with the perineal care, I am now going to proceed at the back of the patient. Now I am going to place the bath towel alongside at the back of my basin and her buttocks. Now I'm going to place a blanket over the patient.
Now, ma'am, I'm done with your bathing. Now, how's your feeling?
Fresh.
Thank you, ma'am.
Now, after the procedure, I am now going to perform the aftercare of the equipment that I have used to maintain sterility and cleanliness of those equipments. Done, I'm now going to perform hand hygiene to deter the spread of microorganisms. After that, I'm going to document the procedure that I have done. So that is for my return demonstration. Thank you for watching.